washes and rinses. There may be surgical procedures that the ears, nose and throat specialist can actually advise on. So seek attention first, I would think, at the level of your primary care doctor, whether in the health center or privately, one of the private practitioners, and then if necessary, you may actually want to consider seeing a specialist for ears, nose and throat. So a lot of information is also available online, but sometimes persons are rightfully wary of these sites, especially as many of them will have unsubstantiated claims and remedies that will be of no value and can actually be harmful. Right, so let's return to the phone lines. Hello and good evening.
Hello, good evening.
Thank you for joining us, ma'am.
I called a couple minutes ago, but just a few seconds ago,
okay.
I was told to hang up, so I tried again.
Great. Welcome, and thank you for returning the call.
Okay.
Yeah.
You're most welcome.
Hello? But you're on the air now.
Okay.
Yes. But do you have a question? That you wanted to ask?
Up now.
Oh, it sounds like we actually lost her. So the phone lines on the screen, 663-8373 or 645-4426. You're watching Doctor in the House, the Open Forum, and the theme for this evening, healthy lifestyles. Let's return to the phone lines once more. Hello and welcome to the show.
Hello, Doctor. Good night.
Hello, good evening, welcome.
Hello?
Yes, hello. Listen on your telephone. It's better to listen on the telephone.
Hello, good night.
Hello, you're on the air.
Hi, Doctor. I have a problem I want to talk with you about.
Hello?
Yeah.
Hello, but you can repeat what you said? I'm sorry. So
it was problem I'd like to talk to you about and find out some information.
Okay.
Well, I'm 20 years of age and I have polycystic ovary.
Right.
And, well, with this, I just get plenty pain in my belly and see my periods for 8 months a year.
Okay. So I know that polycystic ovaries, that is probably the commonest problem affecting the hormones in younger women like yourself. And it's associated with not just issues with the periods, but sometimes with weight, sometimes with acne, with hair growth. And there may be issues as well too as the years roll on, sometimes with fertility. So I think, but the important thing with polycystic ovaries, but the important thing and the cornerstone for that is weight loss. Diet and exercise. We're speaking about maintenance of a healthy diet for diabetes and hypertension. And that applies to polycystic ovaries. Avoidance of too much of fried, greasy, fatty foods, the carbohydrate-rich foods, and you want to replace more with fruits, vegetables, peas and beans, and low-fat foods. And there's an increased risk in patients with polycystic ovaries and diabetes. So you are at an increased risk, especially if you have things, well, if you're Trinidadian, if you have a family history, and if you have issues with your weight. But weight loss will certainly help to regularize some of the symptoms and may help with your menstrual cycles. Some of the doctors actually recommend drugs like metformin that may help a little bit to weight loss, and persons might start with a contraceptive pill to actually ensure that they have a regular cycle. But it's associated with many issues affecting the sugar, the fats in the body, and some persons also find that they may have anxiety issues too, but depression and anxiety can occasionally be a part of the syndrome. Have a chat. I'd recommend that you do some basic blood tests, that you monitor things like the sugar, the cholesterol. Sometimes if the doctor thinks that you may need certain hormones, I am assuming that you did an ultrasound already, of the ovaries. But the first thing that your doctor will want to chat with you about, I would think, is lifestyle changes, trying to get towards weight loss, and seeing whether that helps first, and then some other medications could form a part of your regimen. you may want to see a gynecologist in time to come, but many of these illnesses can also be managed by your GP, a general practitioner, or at the health center level. And it's so common that we're seeing so many younger persons like you with this illness, and it can be something that you can address by simple lifestyle changes. Okay, but thank you very much for taking the time to call in. We certainly appreciate it, especially since, as I said, that is the commonest hormonal issue, and it's associated, it's fraught with so many issues that we don't often delve into. Sometimes as doctors, we don't see the patient as a person, and so I spoke about the fact that many of these individuals, it's easy to write a prescription. It's easy for me to say, okay, change your diet or go on exercise, but the reality is that it's harder in practice. And many of these individuals have low self-esteem, they're anxious, they have issues sleeping, their mood is low, they may be depressed, and they may also need aspects of care apart from just the periods, apart from just the extra hair growth or acne. And I wish you all the best in dealing with polycystic ovary syndrome, which I think is a silent, hidden epidemic worldwide. Right, so let's take another call. Good evening and welcome to Doctor in the House. Thank you for joining us. Hello? Hello?
Hello?
Hello?
Hello. Good evening, doctor.
Welcome. Good
Doctor,
evening.
I'm a very what should I say, regular fan of yours.
Thank you.
And I really enjoy your programs.
Bless you. Thank you for calling in.
Okay.
That's very nice of you.
Okay, doctor, I have two questions.
Certainly.
The first one is, just about half an hour ago, my dogs had a fight.
Right.
I was not nearby, but I said, well, look, I'm going to move away as far as possible.
Sure.
So that I wouldn't get too near to them. But it seemed as though they followed me with their fight. And I don't know, afterwards, I felt pain on my shin bone.
Okay.
Between my knee and my ankle,
Right.
midway.
Okay.
And then I looked and I saw a little scratch, but then I had somebody look at it. But they said, no, I'm seeing like some bites.
Mm-hmm.
So I don't know if the tooth caught onto my foot, my leg.
Sure, it may have been accidental, yes.
And then a few minutes after, oh gosh, I felt as though I am being stuck with a needle into it. And it was very, very uncomfortable and painful. So I don't know. I'm very worried. I don't know what is that for.
Hmm?
Can you tell me what could have happened there?
Thank you very much for taking the time, and I'm so pleased that you're one of our regular, insightful viewers on this show. So I could hear that you're very troubled, but distraught over what has happened, and rightfully so.
Yeah.
Apart from the fight itself is often something that is stressful when you're seeing it. So, and then it sounds like you were actually affected too. These nicks and these cuts or bites or abrasions in the skin can sometimes get infected, so you must be careful, especially as we have millions of bacteria in our skin. You may want to ensure that you're up to date with your tetanus injections. The vaccinations for tetanus are usually administered once every 10 years. And ensuring that the wound is clean and dry. So I think washing with soap and water should be ideal, just ensuring that around that area where you think that you got cut or nicked, that is kept clean, and monitoring it. Certain persons may need antibiotics, particularly if it becomes red, hot, swollen, if you have a discharge. So if it's extremely painful, you may want to consider antibiotics in time to come, but it may not be routinely indicated in everybody. So making sure that the wound is clean and dry, and just ensuring that a tetanus vaccination is up to date would be a prudent initial start to your management. And of course, observing for any chance of infections too. In terms of that sharp pain, perhaps now of course I'm not attempting to diagnose over the telephone, and that's one of the disclaimers for Doctor in the House, that we're not attempting to diagnose. It's just meant perhaps to allay some fears and to guide you in the right direction so you'd be able to have a reasonable chat when you see a doctor. And perhaps it would be an issue with maybe some of the nerve endings, so may have been affected, and many of these wounds, these superficial wounds, can sometimes feel like that, these sharp sticking or burning, pins and needles sensation. So if the nerve endings have been affected from that cut or abrasion, I would just monitor it for now, observe for symptoms or signs of an infection, and if you're unclear, seek medical advice. But thank you very much. I wish you all the best for that. I can hear that you're very anxious and worried over that incident. And indeed, we certainly appreciate and value your call this evening. As we return to the phone lines, good evening, and thank you for joining us on the show tonight.
Yeah, hello, yeah, thank you.
Yes, sir.
Yeah, Dr. Daniel.
You're on the air.
Yeah, good night, I'm Dr. Teelucksingh. Wonderful show. Always appreciate when you come on. Sometimes when I ain't seeing you on a Monday, I just miss the program. But you just carry on such an educational program so people could learn and get some remedies and ideas to how to go about their problems now.
Thank you very much, sir. The pleasure is mine.
That 110%.
Blessings to you and your family over the season. Thank you.
Right?
Yes.
My wife had... Same to you, brother. Same to you. And my wife had some massive surgery some years ago, and they put on problems. But they put on, she taken the baby aspirin, right?
Right.
But recently she started spitting a little blood and things. So tell me the side effects that the aspirin caused over a period of time. I think they take her off on it recently, there about 2 weeks ago.
Okay.
But give her a natural remedy that she could use to keep the blood in check. Right? And I want to ask you a question.
Yes.
Saffron, is saffron a good natural remedy to use to keep the blood in check on a regular basis?
Right.
But I don't think it has any side effects according to the information that I've gathered, right?
Yes.
But I'll listen to you off here. Thank you very much.
Thank you very much, sir, and enjoy the rest of the evening. So it's an excellent question. That's the first thing. So I know you didn't delve too much into the nature of your wife's surgery. So, and I can see a lot of the older heads and they're stroking their chins and nodding thoughtfully about the idea of saffron and turmeric. And a lot of these home remedies are actually making a resurgence. Now, it's not that they are not effective, but we don't have a lot of scientific research, or at least the extent of the scientific research is limited. Many of these studies that we can find on the internet might be smaller studies. So, and of course, no one would have done actually a study to compare the use of aspirin in certain people versus the use of some of these things like saffron, turmeric, ginger, garlic, and so on, that persons often would use for things like blood circulation and blood pressure and so forth. So we can't actually tell exactly how much would be beneficial, but conventional wisdom, and I've seen this on some of the shows even in America, and some of the smaller studies have been pointing towards definite benefits for things like saffron. As to how much, but this is where the problem arises. Definitely safe. So I know my mother and my father actually are huge fans of the use of saffron, and they drink it regularly. Saffron, ginger, a lot of these remedies might be valuable, not just for things like improving blood flow allegedly, but persons may use it for things like colds and things like blood pressure. Check with your doctors first, I would think. Some of the side effects of aspirin might include bleeding from the stomach, the lining of the stomach, and of course, since it affects blood clotting, that you're likely to bleed from any part of your body. As to whether or not these herbal aspects can be alternatives to aspirin, it might be safer to chat with your doctor, especially since if the aspirin is actually essential still, although it was stopped temporarily, your doctors may want to consider restarting aspirin or similar drug to aspirin in order to ensure that the blood does not clot. So it's hard for me to say whether or not things like that are actually viable alternatives, whether or not we can say, well, okay, it's safe to discontinue aspirin and use this, and use something that might be an over-the-counter remedy. So chat with your doctors first before you're thinking about things like saffron or moringa. So that's also making an appearance now too, very much onto the tables of Trinidadians and actually having valuable effects. But persons are actually saying subjectively that they feel better. But don't stop your conventional drugs that are prescribed by your doctors until you chat with them. So I think that sounds like a balanced approach, that it may be free from side effects, it may be useful, but there haven't been studies, there haven't been some of these evidence-based studies to show that they're going to be comparisons to drugs like aspirin or warfarin or clopidogrel is another drug that's often used to increase blood flow. Fantastic questions, and I think we have a final caller for the evening. Hello and welcome to Doctor in the House. Thank you for joining us. Hello.
Yes, Doc,
Welcome.
I'm Aaron, listening to your program.
It's a pleasure to have you on.
Congratulate you. And I want the information that you impart to your public viewers who are viewing is very, very interesting. It's very interesting. And I am in particular, being a diabetic, recently I have changed my diet and now I use insulin only on the evening. I don't use insulin in the morning.
Right. So it's a long-acting form of insulin.
Yes.
Okay, great. And I'm so pleased that you're following your diet as well.
Yes, I have changed my diet recently, yes.
Wonderful, wonderful. I'm
Yes.
sure that you'll be monitoring the hemoglobin A1C that we mentioned, the HbA1C.
Yes, I did, yeah.
Okay,
Because
great.
just around 2 months ago,
Right.
my doctor did one, and I'd read 7.2.
Okay.
Yes.
So you're certainly heading in the right direction.
Okay, thank you. And you
Thank
have
you.
a nice afternoon, and maybe I'll see you someday.
Thank you very
Yes.
much. Thank you very much for taking the time to call in. You certainly sound like a very knowledgeable woman of class. And like all of the viewers that we have on this show, men and women of class and excellence. And in closing, I wanted to repeat a video I've had. So this was aired on the last episode that I hosted Doctor in the House in the month of November. And it was a video that was sent on WhatsApp by my mother. And due to the numerous requests from our viewers or callers and listeners who were struck by the valuable information imparted by the video, I just thought that I wanted to close 2018 with the value of healthy lifestyles and maintenance of health being your wealth. Let's have a look.
Many face the same fate, working hard their whole lives, yet earning a spot on the hospital bed in the end. Unfortunately, 3 statements from the hospital is enough to make you go bankrupt. You have a serious illness. Nevertheless, we will try our best to cure it. However, you should know, treatment will be costly. Then, 3 statements from the bank only make things worse. We really understand your situation, but rules are rules. If you can't pay, you'll have to file for bankruptcy. Actually, before you become bedridden, you can listen to 3 statements from healthcare experts to change your destiny. You are your own doctor, the best one. The kitchen is the best hospital. The best medicine is food. In this world, you can have someone drive your car for you, earn money for you, and even spend money for you. But nobody can take your place in sickness. You can virtually recover anything that has been thrown away, but there is something that would be gone forever if you throw it away. And that is life. One of the richest men in Asia, Jack Ma, once spoke of an anecdote. If you put a banana in a stack of cash in front of a monkey, it would choose the banana because it doesn't know that money can buy lots of bananas. Today, when we put wealth and health in front of people, many choose wealth, surprisingly. But did you know? You can't buy health even with all the money in the world. People ruin their lives by the misconceptions they have, and by the time they enter the operating room, they have an epiphany. Nothing is more valuable than health. Wealth with health is an asset. Wealth without health is an inheritance. Most people spend the remainder of their lives depleting their life savings, but in the end, they still can't buy health. What's even sadder is they leave a massive mountain of debt upon death, burdening their loved ones and posterity. Would you resign yourself to a fate like this? You may think that you are perfectly healthy right now, but the collective experience of human society has taught us death doesn't make an appointment. Rising football star Ernie Davis died at the age of 23 after being diagnosed with leukemia. He was never able to play a game in the NFL. Elvis Presley died at the age of 42, suffering from a heart attack due to drug abuse. Jazz legend John Coltrane died at the age of 40. He had liver cancer. How many of our family and friends have left us? Only we ourselves know. Just because you feel strong today doesn't mean that you'll still be strong 10 years later. Many deadly chronic diseases begin to develop from the slightest damages. Today, you still have a chance to prevent them. So why not save a pound of cure with an ounce of prevention? If you don't pay attention to healthcare today, you are destined to pay your healthcare bills someday.